Good morning and good afternoon, everyone. I'm Oraniti Do, Executive Director of the Future of Health. It's my pleasure to welcome you to today's webinar, FOH Connect Sustainability in Healthcare, Building Greener and Resilient Health Systems. A few words about the FOH, Future of Health. It's a nonprofit organization, a community of healthcare leaders, providers, payers, academia, policymakers, industry, and patient advocates, united by a shared mission to build a joint vision of what the future of health should look like and to chart the path from where we are today to where we need to be. I invite you to learn more about the research topics and published papers by visiting our website and following us on LinkedIn. So, I would like to invite our moderator, Charles Chip Khan, co-founder and co-chairman of FOH and president and CEO of the Federation of American Hospitals, to take the lead. Chip, please.
Thank you, Ornette. And yes, I'm Chip Khan, and I'm president and CEO of the Federation of American Hospitals. The group that I work for represents around 20% of the hospitals in the United States, and we do health policy for those health systems here in Washington, D.C. I want to welcome all of our panelists this morning and give a brief introduction, and then we'll get into the questions. Thank you for joining us today for this Sustainability in Healthcare session. I am honored to be joined by these five remarkable leaders in healthcare sustainability as we discuss urgent issues facing global healthcare systems. When examining the relationship between healthcare and the changing climate, we often only address the impacts that the climate has on health and rarely look at ways in which healthcare systems impact that climate. Although it is not often discussed as a major contributor to pollution, emissions, and global warming, healthcare has a significant impact on the climate. The healthcare system accounts for about 5% of total global greenhouse emissions. That might not seem like a lot, but as Dr. John Perlin, one of our guests this morning, mentioned in a recent FOH presentation, if healthcare was considered a country, it would be the fifth most polluting country on the planet. As we continue to shape the future of health, sustainability must not only be a focus, but should be a priority. Climate change related disasters like floods and hurricanes are becoming more and more common, and prompt emergency responses putting immense strain on our healthcare infrastructure. The World Health Organization estimates that between 2030 and 2050, climate change is expected to cause 250,000 additional deaths from undernutrition, malaria, diarrhea, and heat stress, along with 3.6 billion people who live in areas that are highly susceptible to climate change effects. The environment will continue to affect our healthcare system in a myriad of ways, and unless we address the issue of sustainability, we will continue to contribute to the problem instead of the solution. That's why discussions like ours today are critical. Healthcare leaders must recognize our role in global sustainability and work to address it. Today, we have gathered some of the top leaders in healthcare sustainability from around the world to discuss their thoughts on how to promote sustainability in healthcare. We'll discuss effective strategies that healthcare systems can take to reduce their environmental impacts, coalitions to address these issues, and innovative solutions to promote sustainability within healthcare. So, I'm going to let each of the panelists introduce themselves when I ask my first question. So I'll begin, and then I'm going to go alphabetical and do a round robin. But if everybody would take on this first question, which is sustainability, it should be a global priority. There are many challenges from achieving sustainability. What do you think are the two or three greatest challenges facing healthcare systems worldwide who are trying to adopt and adapt to sustainability? And I'll start with Dr. Christian Abshaven from Switzerland. And if you could give us a couple of sentences on your bona fides, and then get into what are the two or three top challenges here.
Yes, of course. Thank you very much for having me here. It's a great honor, a pleasure being able to speak on this topic. Well, I'm a medical doctor by training, probably not the only one in this round. And I'm now leading the sustainability efforts of the university hospital in Basel, third largest town in Switzerland. A bit famous for its carnival, probably, which is happening just right now. So other people's are out on the street. And it's also one of the oldest universities in Europe, and I have the honor to be responsible there as well for integrating planetary health and sustainability and healthcare into the medical studies and other health studies. And last but not least, I'm co-president as well of a quite recent young consortium, which is called ETIC, Ecological Transformation of Healthcare in Switzerland. So, well, the topic of today is kind of my topic. And as you have pointed out correctly, well, we are speaking so much about climate change, but and unfortunately, health systems, healthcare facilities are rather fire accelerator there than part of the solution up to now. And probably we mustn't separate those crises, which are then biodiversity loss, chemical pollution, all the medical treatments and good innovations we have all have an environmental footprint. So coming to your question, which is of course a huge question to start, what are the most pressing, urgent things to address? Well, in large terms, it's all about resilient. I think even in rich countries, we are not resilient enough for the challenges that we will face. And then it's about mitigation and adaptation. And as in rich countries, rich healthcare systems, I think our duty is even more on mitigation to lead the way and find innovative solutions there and help poorer countries being able to adapt to provide their healthcare services in harsher times. So this would be my try for a first answer, and I gladly hand over to the next person.
Thanks, Christian. And so, Professor Amaya Negev, would you take the baton next? Oh, you're. Oh.
Hi, good morning, good afternoon. I'm from the University of Haifa in Israel. At the School of Public Health, I head the program on health systems policy and administration. And also I have a lab where we work on health and climate resilience. So I thank you and honor you for organizing this important panel. I would like to suggest two challenges, but also to note that these are great opportunities for the health system if we manage to tackle challenges in the appropriate way. We have an opportunity to improve life, improve public health, and reduce the burden on the health system. So I'd like to keep that in mind as we speak about the challenges. The first challenge that I would like to propose is the one of intersectoral collaboration. Basically, climate resilience requires a transformative shift of systems, not only health systems, but every system that wants to become resilient. Health systems tend to focus on medication and on patients, but in order to be resilient, we have to work with many other sectors. We have to work with urban planners, with infrastructure, with energy, with welfare, with education, etc., etc. If we do that, we will be able to create better environment, even in a changing climate, and promote health. But we have to go out of our silos for that, and that's always a challenge for large systems. And the second challenge that I think we are facing is the implementation gap. So as you said, we know that climate kills. We already know for maybe 2 decades that climate change is the biggest threat to global health. in the 21st century. We have the science. We also, to an extent, have the policy. So many countries have already published national adaptation plans. Many health systems and ministries have published health adaptation plans. But when it comes to actually implementing these plans, we often have a gap. That is, we as countries, as governments, as systems, don't allocate enough resources, whether it's human resources or budgets. We are interrupted by other emergencies. For example, here, obviously the war, but also worldwide. During COVID, about half the countries reported to the WHO that the epidemic had a major negative impact on their efforts to adapt to climate change. And in that respect, again, this challenge is something that we can turn into an opportunity, but that will require work and cooperation. Over.
Thank you so much. John Perlin, Dr. John Perlin, would you take the baton next?
Thank you, Chip. And hello, everybody. It's an honor to be with you. Many thanks to you, Chip, to Ornate, and the Future of Health for putting together this terrific discussion. My own background, I'm a general internist and had the privilege of leading some large health systems, including the U.S. Department of Veterans Affairs Health System. Now the CEO of the Joint Commission domestically and Joint Commission International. And I have confession. I didn't spend my professional life training to learn about the effects of climate on health or the effects of health on climate. Those are things that I learned through the National Academy of Medicine, co-leading their effort on decarbonizing healthcare, and from terrific colleagues like Sonia Roshnik, with whom the Joint Commission sponsors international sustainable healthcare certification. The work that Sonia and Nick have done, sets an international example of what can be done. But the truth is that we're not doing enough, and the world is changing in front of our eyes. It's personal for many, those climate refugees and migrants who already have been affected. My own family is fortunate to have a home in Florida. This past year, it suffered 3 hurricanes, losing windows in the first one and the roof in the second one, and flooding in the third one. So it's no longer a dry lab, and that particular location has not experienced any extreme weather challenges over the past 100 years of recorded history. It's clear, as Maya said, this is known to be a threat to health. And 2021, the British Medical Journal published that, along with 233 other journals, that this was the #1 threat to health. And it's clear that it's impacting all forms of health, from physical health, respiratory and cardiovascular disease, to vector-borne diseases from mosquitoes, to waterborne diseases, to mental health challenges associated with dislocation. And it's clear that health professionals believe that they should be doing more, according to a Commonwealth Fund study, and that younger individuals want to see environmental stewardship. But nevertheless, it's, the question as to, Chip, that you asked about what needs to be done. Yes, there are challenges with finances, resources, in certain quarters, knowledge, competing priorities, and complexity. But in my country, it's also become a highly charged political issue. And the cross-sectoral alignment that was alluded to originally is absolutely essential. And one needs to have a coordinated approach. But in the infamous words of Don Berwick, the great thing about benchmarks is that they're not theoretical. And so despite some of those challenges in each of those domains, including political, there are shining examples of major health systems, countries, and facilities in low resource environments that are really leading the way, and look forward to discussing that more in the course of our discussion.
Thanks, John. So next I'll go on to Sonia Rushnick.
Thank you very much, and thank you for inviting me here. it's great to see familiar faces and new ones again. So I guess that my history or where I've come from is that I'm not a sustainability expert at all, and I haven't trained for the work I've been doing. I have worked for a decade plus as an occupational therapist in different countries. I've worked in hospital management in a teaching hospital in Cambridge for a while, but then I've been on a sustainability journey with the NHS, thanks really to the Climate Change Act that was put in place in 2008, and where the NHS had to think about, well, what do we do about that? And now I'm working with the Geneva Sustainability Centre, which is part of the International Hospital Federation. And I guess I was going to tackle some of this question in a slightly different way. For me, this is absolutely about transformation and about healthcare taking its responsibility, but we need to recognize that it's going to touch every aspect of healthcare. So that might be from clinical practice to new technologies, and it'll touch on other adjacent industries, be that transport, food, pharma. So it's going to be far reaching. And we need to recognize that it needs to be integrated into strategies and plans. So it can't just be a checklist. It's not just a one-off. This is something that really has to be worked on very thoroughly, and it will evolve and be a journey. So we don't know a lot of what we are going to need to know in order to get it right. So for me, I would say that my ultimate challenge is that we need to recognize this as a leadership issue. And really support the development of competencies in this space, so that we need to be future focused, be able to deal with emergent issues, complexity, and they all require a style of leadership that's more systems orientated, more collaborative, more learning based, and across all professional groups. So that's what I'd like to say, is that we're all going to have to be leaders in this space at every level of everything we're doing. And it's going to be quite a long journey. So let's enjoy it as well. Thank you.
Thanks, Sonia. Professor Nick Watt.
Hey, friends. Never let Sonia get away with saying that she's not an expert in sustainability. That's nonsense. What are you talking about, Sonia? Hi, everybody. My name is Nick. You can tell from my accent, I'm Australian. I worked in sort of the links between health and climate change for a while with the Lancet Countdown and a few of the Lancet commissions on health and climate change with the World Health Organization and with the NHS as its chief sustainability officer. I'm now down in Singapore doing some pretty similar work. If the question is what is the most pressing challenge, the answer is pretty clearly, sustainability challenge. The answer is pretty clearly climate change. I think everyone's sort of said that. Within that, what's getting in the way? I would posit it's not a technological challenge in the case of healthcare systems. I'd posit we have pretty much all the technology we need. I reckon it's not an economic challenge either. In fact, I think I know that we can act on about 72% of the emissions profile of an average high-income healthcare system with no additional capital pressure. And where there are capital requirements, we also know that the return on investment for all of those net zero interventions you want to do, they're better than almost anything else out there. It's not technological, it's not economic. Jonathan's already talked about the passion that you see from healthcare professionals in the United States, right the way around the world. The study from the Commonwealth Fund and quite a few others out there saying, yeah, no, if you ask healthcare professionals, what do you care about? They stand up and they shout. The response is thunderous. I want to work for a healthcare system that lives up to my own values. First, do no harm. I think the challenge is that we've been a little bit slow. I think the challenge is that, quite frankly, the transport sector, the agricultural sector, power generation sector, pretty much every other sector of society for the last 30, 40 years has been getting on with it and actually making some pretty impressive strides. Healthcare has been a little bit slow here, so our real challenge is, can we catch up? It's about pace and it's about scale. Sometimes we're really, really good at that. You can see health professionals move mountains when you see a global pandemic like we did just a few years ago. And other times, I'm a doctor. I trained initially as a doctor, so I can complain about how annoying doctors are. We can get in the way of change. We're pretty damn good at inertia as well. But I think that's where this is. This is all about, can we mobilize people and systems to move quickly?
So let's start with addressing that change. And Christian, Can you give us, from your experience, sort of taking on this leadership role, what are specific initiatives at the University of Hospital Basel that have successfully reduced waste, emissions, or energy consumption, and what challenges did you face considering you became a change agent there?
Okay. Um, I will do so gladly. Give you specific examples in just a second, but before, and a disclaimer first, of course, we haven't found the magic formula. So there are topics we are somewhat trying to lead the way, others we are lagging behind. Then second thing that um, referring to Sonia, it's a leadership issue, but everybody can be a leader. So I think part of the solution is that you have top down and bottom up. We are luckily enough that our board of directors is supporting that, but that we find and search, and that's part of my job as a head of sustainability, all those change agents in the institution. And then third, being a medical doctor, I'm really convinced of what Maya said, that there's a lot of promise in, and so the best examples are those around choosing wisely, smarter medicine, value-based healthcare. But having that said up front, so coming to three examples. One out of the energy world, I think, already far before the terrible war in Ukraine and the energy crisis that hit Europe by then, our radiology department just researched, investigated, published on how to save energy in the radiology department. If you say like CT and MRI scans, one MRI scan that consumes equivalent to 25 family households of energy per year. So like our fleet of MRIs and CT scans consume more than a medium-sized village in Switzerland, and they had to realize that the providers didn't even know their own machines. We had to team up with our energy department to do all those measurements, and it's not rocket science, but it got published in radiology and was on the RSNA. So you can look all this up in publication. And this was a good way forward. Then they turned on to computers and printers and had a little script printed on just that you can distribute over the whole hospital in measuring which computers are turned off, turned on. Why wouldn't they be turned off over the weekend? This is from the energy world. Then from the more material resource waste world. There again, in the sense of the word, you have to get your hands dirty. It's really about waste audits. We are not haven't scaled this up yet. There are probably other hospitals that have even more experience, but it was just mind and eye opening when we did one with our endoscopy unit. Then we could go to our regulatory body and find other solutions of liquid waste that we would burn. Up to then, Switzerland is a waste burning country, and burning liquids it's a bit senseless. So and there you have really economic benefits and ecological benefits if you just can now drain it. And there, this is another important cornerstone or mosaic stone that, of course, you team up of also with your infectiology department and hygiene department to have this all solid. So that's on the waste audit, and you have to find the people that are willing to going the extra mile, because it's for a few weeks, it's extra effort, but in general, you find them, and they're even happy to help. And last but not least, maybe one of the largest initiatives, which wasn't started at all as a sustainability initiative, but there again, rather from labor and finance saving perspective, it was that we changed our patient catering completely from classical cook and serve to now pre-cooked meals, which just allows to go from having peaks and having people preparing meals over noon and on Sundays and so on, to a rather a pull system where you produce these meals beforehand, and then you only reproduce when the level gets down. And this saved quite just huge amounts of food waste. And part of this story is as well, there is no free lunch, but of course we generated more plastics waste because those meals now are pre-configured in a plastic envelope, so to speak. But as we know from the gherkin, maybe so it's better to save on food waste than have this little extra bit in plastics. Of course, there we have to find solutions as well, but definitely, yeah, what we reduced there in resources in food, weighs out by far what we produce, what we have to produce on plastics there. So maybe
Thanks,
just 3 examples.
That was really helpful. So Maya, given your work across disciplines, what do you see as the major global gaps in how governments and healthcare institutions, healthcare systems address climate and the mix with health issues? Oh.
You're still in mute, Maya?
So 2020, I'm sorry. We've been teaching in person for a while. So I think that one of the challenges of health systems worldwide is that we don't think of ourselves as a part of a wider system, and that we don't think about health co-benefits. If we take this as an opportunity to transform the way we think about hospitals and healthcare and community healthcare, we can start collaborating with others and asking questions about how even hospitals look. So I happen to live right next to a hospital. It's a major concrete zone surrounded by desert of asphalt that serves as a parking lot for the health workforce, and then fences all around. This is not a healthy environment. Imagine if hospitals could be green spaces integrated in the urban landscape, where people commute by active transport, where people have a healthy diet. All of these will have, it's not even a win-win, it's a triple benefit. It's mitigation, it's adaptation, and it's health promotion. And these are all low-hanging fruit. For example, Sheba Hospital right here in Israel, they took off the fences and they started, and they have a vision to work more with the community and more with the tech industry nearby, so we can see ourselves as a part of a thriving system. And we are not there yet. The challenge is that we are spread, health systems are under budget, whether you're in a low-income country or middle or high-income country, always understaffed and never have the opportunity to think wider. But if we do start thinking about these solutions, every place we touch, whether it's energy, transportation, food, or community, in all of these, it so happens that the healthiest option is also the low greenhouse gas emissions option. Take food, for example. If we serve patients plant-based diets, and that's what we recommend to the community members, the people will be healthier. We know that it reduces risks for diabetes and high blood pressure and cancer, etc. And we will reduce greenhouse gases, and it can even be more affordable. So we have a lot of low-hanging fruit to pick, and I know that some of my friends here in the panel have been doing incredible work and best practice examples worldwide on this, but still at a global level, we are not tapping on these opportunities. And I would also like to mention the huge global divide, the global gap. So in high income countries, we have our own difficulties and challenges, which have been discussed here. But if we take a broader look and look at low-income countries, the situation there is much, much more severe. So the health expenditure is lower, the health expectancy is dramatically lower. Right now, with the cut of US foreign aid, a lot of health plans that are based in the low-income countries and are working on climate-related risks, such as malaria, which is a climate-sensitive disease. So these systems don't have the resources and don't have the global support. And I would really like to note here the global equity gap that we have in any health aspect, and significantly also regarding climate. Thank you.
Thanks. John, obviously the Joint Commission plays a dual role of helping to assure, whether it's in the United States or your role abroad from the United States, quality, performance, and safety in healthcare provision, but also you're a regulator in the American context. In terms of sustainability, what should drive the regulation? What role can market forces play? And then finally, where should voluntary industry action be in terms of the health systems themselves taking this task upon themselves to think in terms of sustainability and have it be one of the filters from a management standpoint that they look at change in operation through?
Well, thanks, Chip. It's a great question. Whether this should be driven by regulation, market forces, or voluntary industry action, the answer is yes to all, and they're complementary. Let's break it down in a couple of ways. I want to just call out my colleagues, Sonia Rushnick and Nick Watts. Government pressure regulation in the UK led to an NHS plan that ends up with net zero by 2040. Again, that Berwick quote, the great thing about benchmarks is that they're not theoretical. And as you look at NHS, it's on a glide path to ameliorate scope 1, scope 2, and scope 3 emissions, direct emissions, energy consumption, and supplies, in short. And it's really extraordinary. In terms of voluntary industry action, I think this is a great untapped opportunity. If I learned nothing from our US National Academy of Medicine exercise, is that there are multiple channels of engagement. And Nick alluded to the Commonwealth Fund study that found that 81% of clinicians think that they personally and that their health systems should be doing more. And being in 86 countries with Joint Commission International, one thing that is a constant is that post-COVID, there is a workforce challenge. And another study from the Robert Half Company shows that over 50% of individuals under the age of 34 who are seeking employment want to be employed by an organization that's proactive in terms of stewardship. If you ask any US healthcare executive, what are the number 1, 2, and 3 challenges or top 5 challenges? It's workforce, finance, and everything else. And so understanding that your workforce and your clinicians are interested means that there is a susceptibility to proactive stewardship. There is a voluntary opportunity in that regard. In terms of one other aspect of market forces is that even as, no pun intended, the climate changed in the United States with the new administration, a colleague who's the CEO of a very large health system, third largest not-for-profit health system in the United States, hedged energy prices for 20 years by investing in green energy. Obviously, the US economy feels more volatile of late, and the ability to hedge costs in energy for 20 years. Actually, I know this individual is committed to a green initiative and greening his health system, but it's also extraordinarily pragmatic to attach to control of a major bucket of cost over the next 2 decades. And then finally, I just want to call out one of the things that's most inspiring to me is that this doesn't have to be something that is hugely expensive. And I know we'll talk about more about the resources, but it's both inspiring and candidly embarrassing when organizations like the MP Shaw Hospital, led masterfully by Dr. Tosif Dean in Kenya, has introduced almost full circularity in a hospital in a low to moderate resource environment. They're really firing on all cylinders in terms of addressing. And so I think these examples, really represent not only what can be done by regulation, market forces, or voluntary actions, but ways in terms of engaging under different political contexts to create, traction in quite remarkable ways. Thanks.
Thanks. So, Sonia, how are international organizations such as WHO, your organization, other global hospital alliances, facilitating a unified approach to sustainability? Even though there's tremendous diversity across the planet in terms of health systems, there's a lot of commonality too. And how do we play on that to bring about some of the principles of sustainability that are being discussed?
Thank you so much. So I guess it would be fair to say that I come from the perspective that I feel the health sector really must do its bit, and therefore these institutions need to voice that. It's not just doing it for a public health and all policies kind of approach, but as a sector we need to be held to account just like any other sector, be that transport or agriculture, and that is going to require actually going a little bit further than just voluntary arrangements. And just to call out on Jonathan Perlin with the Joint Commission International, the integration, for instance, of standards into the accreditation for hospitals is an exact example of saying there's no way around this. It's just got to be integrated as part and parcel of what everybody's got to do. And the further example of leadership of that is that those standards have been made available to other accreditation bodies. So like Jordan is using them. There's another organization in Europe based in the Netherlands that's using them. And so we don't all have to reinvent the wheel. ISQA, the International Society for the Quality of Healthcare, has also been endorsing the fact that it's got to be a core component of healthcare. So, I feel we need to develop recognized standards, but also indicators, ways of measuring improvement and reporting mechanisms. And it is patchy, but it is beginning to happen. And I think one of my fears is that it could become only focused on adaptation, because that could pick up as an emergency issue, but we really need to integrate it into our health sector response. And I guess the next step for that would be to make sure that these indicators are part of the normal set of broader health indicators, health outcomes. So it's a part of everything that we do. It's not a standalone sustainability piece that you do as a afterthought when you've got a bit of time, or in an engineering department at the basement of the hospital. It's got to be much more prominent as part of everything else. And then I would suggest that we would need to really try and make sure that what we develop, or what these organizations develop, is specific to healthcare. So there's a lot of industry agnostic stuff like ESG platforms and all the rest of it, but it's not going to suit healthcare. We do have some specifics about us that are very important for us to address, and actually by doing it that way, we'll be able to deliver better health for the populations and better healthcare. So I guess my view is that we need to be setting the bar quite high. It's not going to be easy to unify systems when there's so much diversity, but we've got to try and make a stab at it. We've done it for other aspects. I mean, the financial world does it for financial standards. We've really got to give it our best shot, and it will evolve and develop. And I guess just going back to the points that have been made about equity, I mean, there is also a lot of work that's happening, and we're working, for instance, with the French Development Agency and Aga Khan and others on looking at how actually some of the hospitals that are in very vulnerable contexts might actually find some of the solutions to sustainability, workforce issues, quality of care in the round, because we've only got one shot at this transformation. So let's be open to some of those solutions, because sometimes in our better resource countries, we are a little bit blind to some of the obvious. So yes, I'll leave it there. Thank you very much.
Nick, so if it's not economics necessarily, and if it's not sort of technology, from your experience from National Health Service, from Singapore and other contexts that you've worked in, how do sustainability strategies get focused? And I think it was Christian that talked about leadership. How do you get it going if they're not sort of naturally, part of the infrastructure?
Yeah, sure. I mean, it's a big challenge, hey. One of the problems I think in healthcare that we face, and I'm being a bit mean to our friends in the transport and power generation sector and other things, because I reckon it probably was pretty complex. They just got to it a couple of decades earlier. But when I look at them, I sort of go, well, your intervention space is pretty simple. You have a bunch of cars that are running on internal combustion engines, and in the future, you need less cars and they need to run on not internal combustion engines. And you have fossil fuel-based energy from oil and coal and gas, and in the future, you need to have not that, and it needs to be a little more energy efficient as you go. In healthcare, in one of these they call them end-use economic sectors in the sort of formal higher identity language. In healthcare, we're a bit weird. We don't have a really simple intervention space like that, and that's because we're pretty heterogeneous, right? The job of a community occupational therapist is just different in every way to the job of a respiratory nurse to the job of an intensive care physician. The drugs they use, the clinical setting they're practicing in, the kinds of patients they're dealing with, everything is completely different. And it means that we don't have 1 or 2 or 5 or 10 solutions. We kind of need a couple of thousand, right? 2,600 drugs commonly prescribed by clinicians across the world. There's over 2 million medical devices, surgical instruments that we use regularly. You need a solution for every single one of those. Every single one of those starts to need to be circular. You need green chemistry for all of those different drugs. You need better prescribing habits from our clinicians for everything there. Which is a very, very long way of saying this stuff's big and complex and there's a million different answers. So I tend to not go looking for what is the single biggest thing that I can go and focus on. I tend to go looking for what is the thing that gets people excited. If it's PPE and too many gloves, cool. If it is delivering medicines faster to patients through an electric bike through the middle of Oxford, because that's easier than a van, cool. But I would chase after the passion and start there rather than try and sort of focus on what that single biggest thing is. You can build up to that. We can develop that capacity by learning, by doing. It's something clinicians, health professionals are pretty good at, as we all know. The one other thing I would say is that I think is honestly the most important thing is that this stuff is hard. It's really difficult. You get yelled at quite a lot. I honestly have just come from a call with some of the biggest pharmaceutical companies in the world for the last 4 or 5 hours where they basically just spent the entire time yelling at us. It was good fun. But you have to go and do this with friends. We have to go and find fun people to go and do this with. There's a story of a physio in the United Kingdom, Rachel, at Imperial College Trust, and she sort of came to us and said, God, I really care about this stuff. I really care about this stuff. It's in my bones, Nick. But I don't think anyone else does. And so what should I do first? And my first answer obviously was what I just said, go and do the thing that you're passionate about. Second answer was go and find someone to do it with you. And she said, I don't think there's anyone else in the trust that cares. But she went around and held a meeting for allied health professionals, the physios and OTs, 7 a.m. that morning, because God, they're hardworking, hey? And 2 or 3 people showed up and they had a nice cup of coffee and they agreed that they'd come back in about 4 weeks' time to have another meeting and they'd talk about the things that they could do in their department. she called me to tell me that that they'd done that. And she was so excited that she'd found 2 or 3 friends, and now they were finally going to get some momentum. About 4 weeks later, I got another call, and she said, "We've got a problem." What's the problem? What's going on? They showed up to their second meeting, and there were 56 people outside the door. Physios, nurses, occupational therapists, doctors. People were just excited and passionate. Someone was saying, "Hey, I've had enough of this, and I'm just going to talk about what I can actually do about it today." I think that's where we got to spend most of our time, is chasing after the sort of smiling faces and the excitement and the passion.
Wow, well, I think that we're getting towards the end, and I think you've really defined part of what I'd like to do in the last question and go around robin. So what I'd like to do is, in a sense, you were describing the bottom up, and I'll get to that in my question. What I'd like to do is, from each of you, sort of think about what would be your sort of key recommendations, 2 or 3 recommendations that we really need to get on with in terms of, when I say top down, sort of the regulators, the governments, those who are setting the rules, because I think Sonia really stressed it's got to be more than just, it can't just come from the hospitals. It's got to come from policy. So what policies are sort of essential, just sort of briefly, and then second, in a sense, what else can we do in terms of the bottom up to see change happen? Let's sort of end with that question, and we don't have much time, so if you could just be brief in terms of, what are the rules of the road that we need to leave our audience with, that government and others who set the rules need to set in place, and then is there anything, in terms of bottom up, that's really important? And I'll go alphabetically. Christian, let me go with you first.
Okay, yeah. Always the least time to think it over, but that's all fine. Yeah, trying to address the different levels. Regarding leaders, or in any case, I think you have to understand the codes of the different systems, how they function. And in the politics, it's power, in finance is profit, and so on. You all know about that. But for the leaders, as Maya put it, and others as well, it's the narrative and the things you can gain with it, and the good things. And I think those leaders, they should at least all be leaders in the healthcare sector, not in any on the other industries, because they know on the value of health and the big gains or the tremendous losses you can have on health. And I think with this narrative on co-benefits, on opportunities, on really purpose-based medicine, purpose-based for their workforce, for their employees, you should get them. And then they wouldn't be managers, as Jonathan and Sonia put it, if they wouldn't want to measure, to benchmark, to compare each other, to have this competitive point of view. And there you just have to provide them with the measures. And this was the reason why we started at our hospital with a sustainability report, just to have the figures next to financial figures on our waste energy consumption. So on the level even higher, politics, regulation, I think we have to keep up pressure, and we can take double roles in our primary profession and then in civil engagement, and there we can play the health card as well. Some of you may have noticed that there were elderly women in Switzerland suing in front of the European Court, and they just made the point of health and their threat, being threatened in their health, and sued the state of Switzerland. And we published an open letter to our government, just saying they are right from the scientific perspective, and we have to do more and help us do more, because we need all those people Nick spoke about, but they need help as well. And this would be just the last thing without repeating Nick. I think I even stole a quote from him for our green teams, like, if it's not fun, it's not sustainable. So we have to get started and have to do the bits that motivate and that show those little wins, and step by step we move on, and then there will be a critical mass to tip the system.
Thanks, Christian.
In my bit.
Maya?
I'd like to focus on the health workforce across all levels and all professions. Basically, I think that regulators and health systems top-down should focus on training the health workforce, because people need, in order to give sustainable solutions to the current challenges, people have to have knowledge and be informed. So, for example, what is sustainability? What is the impact of the healthcare system on sustainability? What are the opportunities? What can people within the system, the organism is the people, right? What can be done? Same for climate change. In climate change, we want to prepare and we want to have respond to events. So we want to have the health workforce be able to identify vulnerable populations, to give them targeted advice, to implement interventions. People can protect their lives and even save their lives if they know how to act if there is an extreme heat wave or a wildfire or flood. So we want to do this prevention as much as possible. If people do get to emergency rooms, we want the health workers to know how to identify and respond to stroke or heat stroke or respiratory issues, or depending on the climate, if it's a climate, depending on the climate extreme, we have many risks and many health outcomes that we should be prepared for. As far as I know, most of the health workforces did not get such training on sustainability or climate, and that's worldwide. Of course, there are wonderful exceptions and best practice to learn from. And I talk both about the new generation that is currently in medical and nursing and physiotherapy, etc. schools, and also those who are already professionals within the system. How do we train them and prepare them to be a part of the effort to move to a sustainable and climate resilient health system? And I really liked the approach of making sure that it is fun and that they connect to their passion in order for them to be on board, and also to incentivize them to do that. So that's about how we educate and train. But I also like to end with noting that we should also protect the healthcare workforce, because they are often exposed to risks, whether it's environmentally or climate. They are often working in, stressful environments. They're exposed to infectious diseases. They suffer burnout, etc. So if we talk about regulation, how we make this system sustainable and resilient, we should also take care of them. So basically, the message is to take care of both patients and the providers.
Thanks, Maya. John?
Yeah, let me divide my comments into three buckets. Make it easier, make it harder, make it cool. And so in the first bucket of make it easier, I think we've all alluded to the importance of education. If you don't know the issue, if you don't know how to account for carbon in healthcare, then you really can't get started. And so we need to provide supports for education and understanding. It needs to be a part of the required clinical curricula and the administrative curricula for healthcare individuals. And we should host for governmental leaders and policymakers. Second, we need to find ways to incentivize, and depending on your circumstance, that incentive may be backdoor. I worry about the U.S. being out of position, for example, in electric vehicles, given current policy. Clearly, the world's going that way. And so incentives for economic productivity that actually carry this as a payload, I think, is tremendously important. Third, when you look at green financing for healthcare, at least in the United States context, it's difficult to put that together. And so syndication of opportunities to purchase green energy or green product, et cetera, would make it easier. The flip side of that is to make it harder. And one part of that is market forces, which will tie back to make it cool. So I'm going to come back to that. In Europe, if you're a multinational company and you want to float bonds, then there are ESG requirements. And so to make it harder, there's policy constraints that make it necessary to endorse green are tremendously important in that regard. And then finally, to make it cool, we live in a celebrity culture. We need to find ways to really endorse and embrace. And flipping it, making it uncool not to endorse or embrace. It's kind of interesting. Over this past summer, I've been a car nut in the United States. We call these gearheads my entire life. Bought an electric vehicle, not one that's been in the news a lot lately. And it's the best car I've ever had. It's by far the fastest car. And when others see that, that's it's sort of influential in that regard and in an organization. And I think we need to find ways to really be more effective in marketing communications to get our message out in ways that facilitates channels of engagement to those who came to health because of their call to service and social commitment, channels of engagement because it makes sense financially, and channels of engagement because there are constraints that ultimately make things work. So make it easier through certain attractors, make it harder through certain constraints, and make it cool because that's the sort of socially connected world we live in. Thanks.
Thank you, John. Sonia, we're getting close. So if you could be quick, that'd be great.
I'll be quick. I guess the main thing is that everybody needs to get started. And I would say you don't need to be a climate scientist to get started. So the big thing is, how do we get everybody getting started? And some of that might be about talking to the unusual suspects and not, broadening out the discussion to as many people as possible. I would agree also that we need to do two things. One is make it uncool and easy, which is that, if you think of health and safety, that is uncool and systematic and everywhere. And we need to sort of think of that transformation and that systematic way of embedding something so that it's second nature as a similar approach. And then I'm hoping that some people will find innovative ways of making it easy, like being able to track carbon for every aspect of healthcare, every product, so we can actually make the choices really easily with carbon in mind. And so over to you for making it all happen, Nick.
Let me just say, I want to thank the audience and say that we unfortunately don't have time for questions, and I'm going to let Nick have the last word and close us out. Nick?
Andres. It's 10 p.m. here, so I'm pretty excited to close and finish on time. Thank you very much, Chip. Look, I already said it, hey. I obviously agree with everything that the panelists have said, but you got to do one thing. You got to do the one thing you're actually going to do. You got to do it tomorrow morning at 9 a.m. You got to do it with friends. And at the system level, you have to take this seriously. This is not something that can, the whole way through to 2050, just run on sort of fumes and goodwill. You have to resource this. You need non-negotiable. Stop trying to do this stuff for free. You need a chief sustainability officer. You need a team. It needs to be well resourced. If it's anything like the experience of the NHS, you put in £17 million a year into that team, you bring back £780 million out the other side. It's sort of common sense.
Great. Well, thanks to everyone. Thanks to the panel. And hopefully this is that if we get a good response from our audience, which I'm confident we will, we may come back and have a chapter 2 here on sustainability. So with that, everyone have a good day or a good night.
Thank you very much.